My name is Valerie Cordero, and I am co-executive director of Families for Depression Awareness. And it is a pleasure to invite you to this Facebook Live event, Ask the Experts. And the topic for this evening is teen mental health, teen depression, substance use, and parenting. We're so fortunate to have with us Khristine Heflin, and I will tell you a little about her so that you know who we're going to be hearing from, who is our expert. Oh, by the way, hi, Khristine.
How are you? Thank you for having me so much. I'm so excited to talk with you all and our families today.
We're really excited to have you. And as people are joining on, please remember that the whole purpose of this event is for you, the listeners, the parents, those who are interested in this topic to ask questions. I will be watching the questions as they come up and trying to get to as many as possible. So please do try to submit those as things are going along. So I'm going to read Khristine's bio, and then we're going to start off with a few questions just to get the ball rolling. Following that, we will just start answering your questions. So again, I'm Valerie Cordero. I'm co-executive director of Families for Depression Awareness. This is our Ask the Experts event with Khristine Heflin, and I will read you a little bit about her. Khristine Heflin is a child and adolescent therapist at a community practice in Largo, Maryland. Ms. Heflin is a licensed clinical social worker and has been practicing since 2006. Her educational background includes a master's degree in social work with a clinical concentration in families and children from the University of Maryland, Baltimore. She is tri-licensed as an independent clinical social worker in Maryland, Virginia, and Washington, D.C. Ms. Heflin has experience working with children, adolescents, and adults in both individual and group treatment. Therapeutic work settings include psychiatric emergency departments, inpatient hospitals, outpatient mental health clinics, forensic, and school settings. So, again, welcome, Khristine. We're so happy to talk to you. And we have a few questions, but just to get the ball rolling, can you tell us a bit about the work that you're doing now and what you how you're practicing today?
Sure. So I am a child and adolescent therapist. I work in Prince George's County, Maryland, and Largo, Maryland, which is a predominantly African American community. I do individual, group, and family work with young people from 5 all the way up to transitional age, which is about 18, 19 years old. Really see them off when they are transitioning into adulthood. So my treatment focuses right now is depression, anxiety. I do DBT skills groups, and it's a multi-family group, including the family. I also do some crisis work, which we have a program where instead of going to the emergency department when you're in crisis, you see an emergency clinician in our clinical decision unit. So I do some emergency work there to really help families see them through crisis and come up with plans, safety plans on how we can keep the young person safe. And then I also do some community work with our local NAMI, National Alliance of Mental Illness, really just community engagement and ensuring that we have services for um, our families outside of our clinic.
I'm sure that is very challenging but rewarding work that
It
you're
it
doing.
is both, yes, but
Yeah,
I love it.
what are some of the most challenging parts and what are the most difficult parts?
Right now the most challenging thing is telehealth. Really, so right now all of my clients I'm seeing are virtually. So initially we were doing telephone and video, and now we're doing video only. And really just being able to hold space with my young people in the office. I really do miss that.
Hmm.
Helping my families navigate new technology issues. And being able to do groups in a virtual format, those are the things that are really most difficult right now. I think pre-COVID, um, really just one of the things, and I think we'll talk about that a little bit later, one of the things that I truly enjoy when working with families is really providing education for families and helping them understand signs and symptoms of illnesses. But that can also be the most challenging because oftentimes our families really don't know what to expect and what's typical versus non-typical behavior. So that can be a challenge.
I completely understand that. We see some of the same things when families come to our organization and looking for guidance as to how to best support their teens. So we definitely resonate with that too. So I'd
Mhm.
like to get to our questions, and then we'll see where the conversation leads us.
Okay.
Why is it important to talk about teen depression and substance use and abuse? Why is this an important topic for us to cover?
Absolutely. Awesome question. I think it's important to talk about teen depression and substance use prevention for a couple of reasons. The first is prevalence. We know that substance use and mental health go hand in hand. And from the data, we know that people with a mental health diagnosis, including depression, are significantly more likely to be diagnosed with someone with a substance use disorder that doesn't have a mental health diagnosis. And specifically, when we're working with our young people, we know that the percentages can be as high as 47% of someone who, between the ages of 12 and 17, may have tried a drug or alcohol in high school. So it's really important to have education for both family members and young people about the signs and symptoms of drug use and also the effects that it can have on your mental health recovery. Um, and what I think is most important, and is something that I remind myself, is that for every year that we can delay substance use and the adolescent brain development, it is it helps us not become dependent on drugs and alcohol. So, what that looks like is, for example, if you use drugs and alcohol at 13 years old, you are as high as 70% more likely to develop a substance use diagnosis in adulthood versus if you were to delay substance use until, let's say, the age of 17, where you are 27% likely to develop a drug and alcohol problem. And that is a significant drop. And so it's important for us as clinicians and it's important for us as advocacy agencies to be mindful of how we talk to our young people about drug use and prevention and how we talk to our young people about how it relates to mental health. Um, Something else that is important for us to be mindful of and I think take into consideration is that our young people often use drugs and alcohol as a maladaptive coping skill. And so when we talk about maladaptive coping skills, what we mean is it's a coping skill, but it is something that is unsafe or unhealthy, right? And so we find oftentimes our young people who may have not been diagnosed with anxiety or may have not been diagnosed with depression or maybe don't even know that that's what they're struggling with, maybe self medicating. And they are using drugs and alcohol to treat symptoms of depression, be it feelings of worthlessness or feelings of depression or sadness or hopelessness. So they're treating those symptoms with drug and alcohol use. And our job as clinicians is to really help them find more adaptive coping skills to use. And so, really understanding the relationship, we don't want to say it's a causal relationship, but really the relationship between mental health and substance use, because oftentimes our young people are using substances to treat their drug and alcohol use. I'm sorry, their mental health diagnosis. And so, if we, as clinicians, do a good job of helping them understand and educating them on signs and symptoms of depression and the effects of drug and alcohol use on your depression, for example, and what that might look like, it really helps young people buy into not using drugs and alcohol. Once you're armed with education, you understand that for the moment, I might feel good, but this actually may cause me to be more anxious in the future if I continue to use drugs and alcohol. And what the data does show us is is that if you are a young person and you are, let's say, treating your depression with marijuana, and later on in life, you might be more prone to have symptoms of anxiety or even symptoms of psychosis. And so that's important information for us to be sharing with family and friends and young people.
What do you think is one of the most challenging things when you have worked with parents and helping them to understand the dangers of substance use, not just in terms of using a substance, but how it can mask other mental health symptoms? What have been some of the biggest challenges? Has it been getting parents to separate that substance use and that mental health condition? Is it getting parents to even accept that their child may be dealing with a mental health condition? What has been some of the most challenging parts of working with parents?
Absolutely good question. I think something that's most challenging, not only just working with parents, but working with teachers or guidance counselors or most adults in young people's life, is the behaviors that bring them into treatment are generally externalizing things. So things that they're doing that they shouldn't be doing, for example. So their grades are failing, or they're fighting more, or they are arguing with parents, or they're getting suspended from school. Those are the things that generally bring me in, or substance use. Those are the things that generally bring my young people in to meet with me. And what we find and uncover is classic depression, right? So what we missed as adults was, you know, feelings of sadness, feelings of guilt, feelings of hopelessness, because it's harder for us to see that, right? That those are the internal things that our young people are struggling with. And so what oftentimes happens is we have those things that we're struggling with internally first, and we start to maybe use drugs or alcohol, and then bad grades come, low motivation come, fights come, irritability come, and then I get them, right? And so the hardest part for me is understanding. Well, I think it's easy for me to understand mom and dad's perspective, but getting them to understand that your kid is not just lazy, right? Your kid is not just up, not doing schoolwork, just doesn't want to go to school, just wants to be bad. That's not what this is. These are symptoms of a larger issue, and that larger issue is major depressive disorder. And major depressive disorder is a disorder of the brain circuit and chemistry, right? And so helping parents understand that what we see is not just your young person not wanting to listen to you, right? Although it might feel like it, right? Although the fights might feel like it, that's not exactly what's going on. And so really working with parents to understand and have some perspective in what that looks like, what that emotional vulnerability may look like for your young person, and being able to expect and anticipate some of the problems, and still work with making sure your grades are up, right? Making sure you're going to school, decreasing the fights with parents. And so really helping parents understand that we can do both. We can still parent effectively and make sure that the rules are being followed, but also being understanding to your child is not just being bad, your child is not just being lazy.
I think that's so important, and that really touches on some stigma and some misunderstanding of mental health. We're going to delve a lot more deeply into that as the conversation goes, but we do have a question about marijuana from
Awesome.
Vincent. So Vincent wants to know if there are 12-step programs for a 19-year-old who is dependent on marijuana. So I guess how young can people be in that kind of rehab? If so, how would you compare their effectiveness with inpatient hospital programs? So this is a two-parter here. Thank you, Vincent, for that awesome question. First, are there 12-step programs for teenagers and specifically dealing with marijuana abuse? And then how do you compare a 12-step program and its efficacy with inpatient hospitalization? So we are
Sure.
actually going to leave that question up so that just in case we want to remember that second part, let's leave that question up.
Absolutely. So, yes, there are 12-step programs for people who are 19. So, one of the things that I like to remind my parents is that 18 and up is considered adult, right? So, even though they are 19 years old, and I'm a child and adolescent a therapist and I still work with young people at 19 years old. They're considered adults, and there are 12-step programs for 19-year-olds to participate in. And what's important to know is that the 12-step programs are self-help programs, and they're peer recovery programs, right? So they're different in partial inpatient partial hospitalization program because inpatient hospitalization provides the highest level of care. And a 12-step program is a community program, which could be considered one of the lower levels of care. And what that means is someone who's in inpatient treatment is functioning at a level where they're not able to function in the community. And then they need the assistance of a residential component to help them learn the strategies to come off of drugs or alcohol. When you're in a 12-step program, you're likely to be functioning in the community, and you still need the additional support among your peers and among your community to help you maintain that recovery process for yourself.
Thank you for that clarification, and thank you, Vincent, for that question. I know there are a lot of conversations about marijuana, and I think teens get mixed messages about it because it is legal in several states in the country, and people look at it as a very non-threatening, it's non-lethal. Some think it's addictive, some think it's not addictive. But when we're talking about teens and mental health, the question really is, how is any substance, how is a substance, whether it's alcohol or marijuana or a harder drug or pills, how is that interfering with or masking those symptoms? So do you want to speak a little bit about maybe some misconceptions about marijuana use
So,
and
so I'll share with you my message to my young people, right? So when they say it's decriminalized or they say that it's legal, I say so's alcohol, right? So alcohol is legal, and that doesn't mean it's okay for an adolescent to use it. Um, Adolescence is a critical period for brain development. I mean, the brain is like firing off neurons, they're learning, they're engaging. And when you introduce illicit substances at that time, it really interferes with our brain development. And we also know that problem solving and executive functioning and impulse control are things that are learned later on down the line. And when you introduce substances like marijuana, nicotine, alcohol, um, any of those drugs or alcohol, they really can stunt the development of the brain. And so my message to my young people is that, just because something is legal doesn't mean that it's okay for you to use. And we want you to be as successful as possible. And we know that if you're using drugs or alcohol, that can, like you said, mask some of your symptoms. You can become more dependent on those drugs or alcohol as an adult. You can have trouble understanding and identifying when something is an issue for yourself, right? And we find that if you're using marijuana, sure, at the time you might feel like you feel some relief, but over time you might become more anxious, or you might even become more depressed and have low motivation, right? And many, if not most, of child psychiatrists will not prescribe anti depressant medication if they know that the young person is using drugs or alcohol because of the effects that the drugs can have on the prescription. So I definitely send the message to my young people that they should not be using marijuana um, in any way, and nicotine or alcohol, even if it is legal or decriminalized in the area that they live.
I got that message. And I think we should keep giving that message out, especially to young people whose brains are developing. And I just want to go back to a term that you use to make sure that our viewers tonight or who watch it at whatever time understand it: executive functioning. Can you
Mm-hmm.
explain what executive functioning is? And in fact, it can also be impaired by, it can also be affected by depression. And
Mm-hmm.
so you could end up having a double dose of the substance and the depression impeding an executive functioning. And why is that important in teens or in anybody?
Sure. So I'm glad you brought that up in depression because oftentimes that gets missed. So sometimes what happens with depression is that young people will have trouble concentrating, or they're becoming more forgetful, or they're seeming like they're lazy is a term that I get often from my parents, or they have low motivation. And executive functioning is the part of our brain that is responsible for the planning, the organization, the focus, staying on task. And when you're struggling with depression, like you said, that can also be affected. Your executive functioning can be affected. So it's important for our parents to be aware that if your young person generally made A's and B's and seemed to be doing well, and all of a sudden now they're failing, that's a red flag, right? If they can't focus, if you have to keep telling them something over and over again, that's a red flag for you to be aware as a parent that something might be different. And so executive functioning is really about the planning and organization. That's the part of the brain that's responsible for our planning and our organization, our impulse control, and helping us make good decisions. And so if we're using drugs and alcohol, it really is affecting all of those things, because it affects that part of the brain.
Great. Thank you for explaining that. I think it's really important for parents to understand that, and that helps to also drive home the message of why depression should be addressed, and also why substances may be impeding the maybe impeding schoolwork, maybe impeding a teen's ability to stay on task, to plan. And so, in both cases, those are things that can be addressed.
Mhm.
So we have another question. We're going to push it out, and we'll see if we can address. So we have a question from Devin. Hi, Devin. So going back to telemental health, what do you wish caregivers knew when accessing teletherapy for teens in their lives? What can caregivers do to help a teen who is resistant to teletherapy or to support positive outcomes?
That's a great
So,
question. What I think is most important regarding telehealth is having a space for your young person to have privacy. Because what I'm finding is a lot of young people are a little bit more hesitant to um, do their therapy at home because of their concern that they don't have the adequate confidentiality that they would when they come into the office. So, as a parent, if you can leave the house during the appointment, I say do that, right? Allowing the young person to know that they have the same amount of confidentiality that they would at their provider's office. Um, Setting up a space that feels safe for them, their own bedroom, not having people walking in and out of the space that they're in, making sure that family members understand that you should not go in the room between 7 and 8. You should not go in the room that's her private time, or that's his private time. And really just reinforcing that the same level of confidentiality that they would have at the office, they should have at home.
I think those are great steps that parents can take. And if a teen, this can go with teletherapy or it could be for therapy in general. Uh, Teens can sometimes be resistant. Parents can be resistant to accepting
Mm-hmm.
that their teen is dealing with a mental health diagnosis, and teens could also uh, be resistant to
Mm-hmm.
accepting that diagnosis. And
Mm-hmm.
so, what are ways? What are some of the ways that parents or other family members can offer support and have positive communication about therapy in order to not force the teen to do it, but as much as possible have a collaborative effort to seek some kind of therapy if there's an issue.
So, yeah, I think one of the most important things to do as family members is when you are concerned that your young person may be struggling with depression or substance use, is really have a conversation with them about what you're worried about, right? And so not having it come across as punishment or punitive, but really sitting down with your young person and saying, hey, I'm noticing your grades are slipping. I'm noticing that you're in your room a little bit more. is everything okay? Tell me what's going on, and really opening the lines of communication in that way. And then coming up with a plan. And you can say, I've really been thinking about this, and I was wondering what you think about seeing a therapist. I think it would be helpful because of X, Y, and Z. And really, not you need to see a therapist because something's wrong with you, but really, as a family, these are some of the things that we can work on. And this is what I came up with. And what do you think? And one of the most important things for parents to understand is that for therapy, it really, the young person really needs to be interested in participating in therapy for you to get what you want out of it. It needs to be an investment for the young person. So they really need to have some goals for therapy. And the goal may just be, I just want to feel better, whatever that means. We'll figure it out. But there has to be a goal for therapy. Um, so if your young person isn't interested in therapy at this time and there's no safety concerns, I would say continue to support them, continue to be with them and validate their feelings and their experiences and remind them that they're not the problem, and really just trying to engage them in therapy and why it would be helpful.
I think that's so key in engaging them, offering the observations that the parent has had,
Mm-hmm.
making it as collaborative as possible. And as you said, if it's not a crisis situation or something that needs to be addressed urgently, to try to wait until the teen is ready so that
Mm-hmm.
they are as invested in the process as possible. I think that's
Yeah,
all. Yeah.
absolutely. And sometimes when I meet my teens, I'll meet with them and it's pretty clear they're not really interested. And part of the initial evaluation is are you interested? Do you have any goals? And they may say, I can talk to you. And if they say that, that's great. If they say that, perfect. And I say to them, think of some goals. We'll talk about it in the later sessions. And I, as a therapist, say if you're not, two things could be going on. The first thing is that you're just not really ready, and that's okay. The second thing, maybe you're not really feeling me as a therapist, and that's okay too. And so I say to my young people, give me 3 sessions. After 3 sessions, if you're feeling like this lady is not for me, let mom and dad know, and we can come up with somebody who might be a better fit. And that really empowers the young person, and I empower the young person. I tell them, this is, you run the show here, this is your session, you come up with the goals, you let me know what will make you feel like this is a good use of your time, because I don't want to waste your time. I want you to feel like this is important and that you're getting what you want. And so really, part of that is the clinician being able to empower the young person so that they know that this is their health and they want them to take charge of their health. But part of that is really they have to be ready. So engagement.
I think that's so key, and really helping, it helps them to stick with it when things are harder if they are
Absolutely.
invested and engaged. So we have another question, and this is about CBD oil. So Michelle, hi Michelle, thank you so much for being with us. Michelle wants to know, where do you lump the use of CBD oil into all of this? Another hot button thing. There are CBD shops and oils and foods, I think. And can you first explain to those who may not know what CBD is, and how it's related to the marijuana plant, but how it's involved in all of this?
Right. So again, my message to my young people is very blanketed. And first, let me say there are some practitioners who are more holistic, and um, they may do prescriptions for acupuncture or using CBD oil. And so it's easier for me, I would say, because I work with young people. If I were to work with adults, it might be something different. But because I work with young people, it's easier for me to have a blanketed statement that anything that involves CBD or THC, edibles, oils, vapes, anything like that, I encourage my young people to stay away from. I'm not going to stop seeing them if they tell me that they're using, alternative medicines. But sometimes we'll sit down and we'll talk about, well, what are the risks and the benefits? Why are you using this? What have you found how have you found it to be helpful? Sometimes I'll give them homework. All right, let's do some Google research. You know what the benefits are. I want you to research all of the cons, and we're going to talk about that next session. And together, we'll come up with what's best for you. But my message to my young people always is to really try to use try to not use anything that is not prescribed by your physician, so your pediatrician or your psychiatrist if you have a psychiatrist. Now, if you want to work with an alternative medicine practitioner, I'll do my due diligence to research for you someone in the community that you can talk to that can give you information. But again, I work with young people, and so it's easier for me to say, well, let's try to stay away from that for right now.
Thank you for that answer. And thank you, Michelle, for that question. We're going to go to a different topic. So, we know that mental health conditions do not discriminate. Anyone from any background, whether it be religious, ethnic, regional,
Hmm.
nationality, gender, anyone can be affected by depression.
Hmm.
And so that goes, of course, with racial backgrounds as well. So, it's alarming, however, that certain members of racial and ethnic minority groups in the US are less likely to have access to mental health services, more likely to use hospitalization, and more likely to receive lower qualities of care. In your experience, how does race impact families and adolescents living with depression and also dealing with substance use and their ability to receive quality care? So, how does race impact this conversation?
Sure. So when we talk about the ability to receive quality care, I think it's important for us to not only think individually, but also to address some of the systematic barriers as well. And things that kind of come to mind as I think about barriers to quality care, um, specifically for our Black and Brown youth, are identifying racism, police brutality, and microaggressions as trauma and things that our young people experience, and really having culturally competent clinicians to be able to understand and identify that these are things that our young people are experiencing. And sometimes, so an example would be, let's say you have a 15-year-old African American male that you're seeing as a clinician, or as a teacher, or as a school counselor, or as a community person, and you are mentoring that person, and that person is important and you are important to that person. Really being able to identify that their experience that they have with the police, for example, or being targeted by teachers who are not minority teachers, those things can cause same fight or flight responses that we have when we perceive a threat, right? So worrying about being racially profiled, having increased heart rate, and having deep breathing, and being on high alert or being hyper vigilant, having to deal with that chronically can contribute to increased symptoms of depression and increased symptoms of anxiety. So it's important for us to be aware of that, and to really think about that when we're working with our young people, because some of the things that we experience as Black and Brown people, they have gone on for so long, and they're so chronic that it's very easy for people to forget that that can be a trauma. And a chronic trauma, we know that that affects our health adversely. So it's important for us to be thinking about that as well. And specifically when we think about quality care, to be a competent clinician, and to have that um, in the back of your mind when you're in session with your young people, because that may come up in a session. And instead of being a clinician that may say, well, is there another way to think about that? Were you really being racially profiled? Is it that you didn't do your homework? That's why the teachers are bothering you. To be able to be with that young person, and validate their experience as a worry and as something that is traumatic for them, and see how that can affect anxiety or depression. And I'm hoping that I make sense. And so
It makes sense
with
to me. Yes, yes.
yeah, okay. And so it, really that's important. I think that's one of the most important things that we can do to ensure that we're providing quality care, and to be thinking about race when it pertains to mental health and substance use as well. And just to go back to one of my original comments also, is that when I meet my young people, it's generally because of externalizing behavior, so things that they're not supposed to be doing. And to be mindful of that when so parents to be mindful of that, clinicians to be mindful of that, and anybody in an area where you can be helpful to be mindful of that. And that oftentimes speaks to increase in hospitalizations and increase in emergency room visits versus having ongoing mental health care, because when we are responding to a crisis, it's more likely that we are going to take our young person to the emergency room versus having them in consistent treatment with their providers, so that we can kind of tease out some of these behaviors and be aware of some of these behaviors. And I think also it's important for us to kind of look within introspectively. We talked a little bit about stigma and how within our community there still is some stigma around getting substance use treatment or getting mental health treatment. And it's important as providers and also as parents to really think about that when we are seeking care for our young people. And I often wonder why there's still stigma. And the only thing that I can come up with is that, we are unfortunately we fell victim to kind of normalizing the trauma that we've gone through. And so we've kind of fall victim to this yourself up by your bootstraps mentality of you have to deal with it, right? And if you can't deal with it, then you're the problem. And that's not the case, right? We have endured so much and we continue to endure so much. And it's important for us to offer ourselves grace and offer ourselves compassion. That's parents and young people. And to be mindful of how systematic racism, institutional racism has really affected our mental health. And so, really being mindful as clinicians as well, and to ensure that we're providing quality care for our young people.
One thing I'll add on to that list is you said offer ourselves grace, offer ourselves. You said one other thing, I'm not remembering it.
Compassion.
Compassion. I would say also offer ourselves healing, that we
Absolutely.
are we are worthy of and deserving of healing. And even I mean, from our teens to our adults. Our conversation tonight is about teens, but uh, we don't want our young people to go through those crucial teen years feeling unheard, depressed, um,
Absolutely.
covering up those feelings with substances, and then being misunderstood, yelled at because the grades aren't great, or because not able uh, to function in the family like they are expected to. Um, that's where therapy, healing, good family communication, um, recognition of mental health conditions as being treatable medical conditions, and that sometimes with therapy, it doesn't have to be a scary process. It can just be a wonderful collaborative therapeutic process with clinicians like you. And so we're going to probably have time for one more question. Before we go to one more question with you, Khristine, I'd like to mention a few things for Families for Depression Awareness. If you're watching us on our page and you're not familiar with the organization, our mission is to help families recognize and cope with depression and bipolar disorder to get people well and prevent suicides. This Facebook Live is a wonderful precursor to a webinar that we have coming up on September the 23rd at 7:30 p.m. Eastern Time. And it's also on the same topic of teen depression, substance use, and what parents and caring adults can do. So I want to mention that. I also want to mention that our annual event, which is happening virtually this year, will take place on October 15th. and it will be done via Zoom. Tickets are on sale, $25 per person. It's a wonderful way to support the work that we do with families and also come and fellowship with us for an hour and bid on auction items and have a great time. So I want to give those couple of plugs. For more information about our teen depression trainings, our webinar, our information, you can visit our website at familyaware.org. For more information about the event, you can also visit familyaware.org and you will find all that information there. So, as our last question, Khristine, I just want to ask you what makes you hopeful about the work that you're doing? What have you seen? What have you experienced that makes you hopeful for teens and for families who are dealing with mental health and substance use?
I absolutely adore working with my families, and my kids are phenomenal, phenomenal kids. I tell my young people all the time that this generation is, they are so awesome. They are the most flexible, non judgmental, inclusive generation. They are the most loving generation. And just that alone makes me hopeful for our future. And I adore working with my families. I find great honor and joy in my families allowing me to come into their lives and work with them. Seeing young people and parents being able to repair and strengthen their relationships and learn and grow together, and learn about mental health, just as they would any other health diagnosis like diabetes or a heart condition, and really help, having them become advocates for themselves, is really encouraging. I think one thing that I tell my parents is that our young people are resilient. Um, and oftentimes, what is most helpful, the number one factor in ensuring that they are in recovery for substances or even for their mental health journey and their healing, is really the support from their parents and their village and their loved ones, and really being able to encourage that and empower the family, and letting them know that they're not on an island, that they're not alone, that together we can do this, we can get better, we can feel better, we can do better. It really fuels my work, and I love it.
That's a wonderful note to end on this great Facebook Live with our expert Khristine Heflin. So if you are in the areas of Maryland, Virginia, or Washington D.C., you can find Khristine and her services. Anything you want to mention or plug, Khristine, before we end?
No, I just want to encourage everyone to arm yourself with education. Know that you're not alone. Seek out good quality care. You have the internet at your disposal, and take care of yourself.
I echo that. Thank you all for being with us. If you want more information about our teen depression programming and resources, visit familyaware.org. We appreciate you and have a wonderful day.